Thanks, Mike. So I'll confess at the onset, I'm so not funny, and I can't for the life of me think of one joke. So I'm starting busted here. I also have to confess that I left the workshop yesterday absolutely with my head swimming with all the good ideas that kind of came forward, and really thought about this late last night, about how we can coalesce around some of these ideas in very practical ways so that we can continue to build on this momentum. I'm a big person on connecting dots. So yesterday we heard about the need to foster access to medicines within a growing and very complex regulatory environment with increasingly sophisticated medicines and with a dynamic global population and disease burden. And we also recognize that all of this takes place within incredibly stressed health systems which will never be harmonized or even aligned. And despite good efforts, very good efforts, by governments, by industry, by academia, foundations, multilateral organizations, and other stakeholders, we know our regulatory world has incredible challenges. The clinical trial infrastructure, the need to reduce duplication of efforts, variable regulatory capacity, and as always, limited resources, among many other factors. There is truly a need to build the business case model, and this needs to be better developed, and it needs to be much better appreciated within simultaneous global development for supply chain integrity, data transparency and data sharing, pharmacovigilance, and how the application of science-based standards can actually save money and increase the efficiency of regulators and industry alike. We recognize the various efforts in standards development. We talked yesterday about harmonized technical standards, data standards, decision standards, among others. And we know that in many places, governments lack the necessary legal frameworks in which to be able to implement international norms and standards, and thus impeding harmonization. Doug Throckmorton, rightly so, spoke about values. He said that while there are interlocking needs, we must better appreciate that countries will have different needs and interests, and thus different expectations for their global engagement. And he also pushed us, and we heard it today from Lembit, but asking, do the same rules apply? Or are there other rules within this complicated regulatory environment that should become more relevant to us as we begin to tackle these challenges? Significant progress has been made through a number of venues. We've talked about ICH, PICAS, APEC, multilateral organizations, public-private partnerships, like many that the Gates work with, and a lot of other models. But it's very, very clear that much more effort is needed. So again, how can we begin to connect the dots? The first is probably around standards development. While this seems to be an area incredibly well covered with strong scientific engagement by government, industry, and others, would it be worthwhile to landscape the various standards that are actually out there to work toward better harmonization? Are these standards duplicative, or are they complementary? Are they different enough, or are they adopted differently enough so that they perhaps cause confusion or actual impediments to implementation? Or do they expand our regulatory science reach in ways that can build trust and create efficiencies? So the second bucket is standards implementation. And while we appreciate that many science-based standards have been developed, what is less clear, I think, to all of us is the success or challenges to the implementation of these standards. And in terms of implementation, do we fully appreciate the struggle many countries have in this area? At times, it's not just about regulatory capacity, but also a lack of strong legal and policy platforms that are absolutely essential for implementation. So can we help build the necessary capacity to adopt, implement, and measure impact? The third area are those issues that we can tackle that are outside of development or implementation of science-based standards, but nonetheless complement or support the harmonization of standards. And a lot of these were talked about yesterday, and they include the sharing and leveraging of data and information, better and more consistent communication, and helping to build regulatory capacity and capability and stronger regulatory systems. All of these, again, can generate trust and confidence and increase our ability to work better together. So if these are kind of our three big areas or big buckets, and I know there's probably more, what can we collectively do? And Mohab said it this morning. How do we take this and move to action? So one area I identified is the need for a strategic and more structured regulatory framework. Can we come together to develop a comprehensive yet flexible and simple enough framework that reflects our collective needs, issues, challenges, and venues in which to engage within this increasingly complicated regulatory scientific environment? With such a framework, we could possibly begin to identify what's already being done, where players can best contribute, better learn from others, and better leverage our individual and collective resources. A lot of models were talked about yesterday. The APEC roadmap was one. We have the PAHO PRAISE system. But the whole area around a strategic and structured framework. And the second area is the need to create safe space. Doug yesterday characterized FDA meetings as safe harbor meetings. And through safe space, could we begin to tackle the elements of this strategic framework in measurable, sustainable ways, utilizing our individual strengths that may be where we may be able to best contribute? Industry is going to contribute in their ways, regulators others, foundations in other ways, but this needs to be pulled together in a way that's cohesive, expansive, and value added. We know that ICH has developed more than 50 standards, but what institutions can help us collectively with the implementation of these standards and an actual analysis of their uptake? PAHO, through its assessment of national regulatory systems of regional reference, is creating space for some of its regulators to share inspectional reports and make better resource reallocation decisions based on risk. And even more importantly, again, helping these regulators to build confidence and working toward mutual reliance. The Critical Path Institute yesterday spoke about creating dialogue around essential data elements and data standards. Yesterday, we identified an overarching goal, and that is to enable success to safe and high-quality medicines around the globe. However, we recognized our world is indeed changing, and I will reflect back to Peter's map that we started the morning with yesterday. Our regulatory environment is impacted by governance overlap, regional and sub-regional blocks, and a true lack of appreciation by many policymakers of the essential imperative of regulatory systems within the public health, the economic development, and the trade context. Thus, the challenges of harmonizations of standards and regulatory convergence are daunting. But it would seem by developing a strategic regulatory framework that can help to guide us all, as well as create safe space in which we have to have essential and yet oftentimes difficult dialogue with all relevant stakeholders at the table, at least possibly success or good progress could be ours. So in other words, can we begin to build a knowledge network so that workshops like this one are a part of a larger continuum to ensure the safety and quality of products to patients around the globe? We want this to kind of be a beginning and certainly not an end. So how do we take this and begin to make it more real for us in a very broader continuum? So thank you.
Thank you, Lou. So David Wood is Coordinator of Quality, Safety, and Standards at the Immunization, Vaccines, and Biologicals Department at the World Health Organization.